If there was one area of information about cancer or cancer awareness that you would like to see in the American public in our region, what would that be? What would make the biggest difference?
Prevention. Prevention is the best medicine. And to prevent cancer, we need to understand our own community, what's going on in our communities. And that's why we take our message out. We know that too many people in Lancaster, for example, die of colon cancer. And that's a cancer death that should be preventable. And we take our message out, get your colonoscopy. That's how you can help yourself prevent cancer.
Berwood, what did you find in the survey research regarding people's awareness of prevention behaviors?
Well, I think people understand that there are behaviors they can engage in to prevent cancers, or at least reduce their risk of having the disease. And many people say they're willing to engage in those, but there is a disconnect, and that we find people who are engaged in certain risky behaviors, like smoking, they realize that they can change their behaviors and reduce the risks, but they seem unwilling at the moment to do so. So some way you've got to bridge that gap between what they know and how they behave to get them to behave in a way that will keep them healthy.
Dr. Hempling, have you cracked that particular conundrum, got people from the point of knowledge to behavior change, and what are the techniques that work best in that challenging arena?
Well, if I could do that as easily as you make it sound, I'd be hosting the program rather than sitting on this side of the table. Certainly we have evidence, reproducible evidence, that a viable screening program will decrease the incidence of a disease, a lethal disease, and will decrease mortality. The classic example, of course, is cervix cancer and the Pap smear. We're beginning to see the same data reproduced from breast cancer after 50 years of mammograms. We're beginning to see the same data from colon cancer. I think an important part of what we need to accomplish as healthcare providers and as administrators is to facilitate access to those tests that have demonstrated that they will have a positive impact upon the incidence and mortality of the disease, and to further explore those possibilities for screening that will take us to a place in a similar situation for those diseases yet to be evaluated.